Hi, everyone. On behalf of the Center for Social and Behavior Change, I'm excited to welcome you all to the webinar on the insights from the Transmedia Edutainment Intervention, मैं कुछ भी कर सकती हूँ. Today's webinar aims to share with you a brief on the entertainment education intervention and key learnings from its digital and on-ground evaluation. To start off, I would request CSBC's director, Dr. Pavan Mamadi, to set the context for today's event and share an introduction to our panelists.
Thank you, Sanjeevni. It's such an honor and a pleasure to have such distinguished members on this panel and to share this digital dais with them. Um, so I plan to do three things in my sort of very brief introduction. The first is say a few words on why the long form of edutainment is perhaps preferred to short message campaigns. Then I want to say a little about what CSBC has done and then introduce our really distinguished panel for today's conversation. So here I go. So persuasive advertising alone, it is found, is not enough to shift behaviors, particularly when behaviors are complex, rooted in mental models, and inhibited by social norms. In this case, longer format entertainment education or edutainment in which messages are embedded in compelling dramas are more likely to persuade and change behavior. I want to borrow the reasons that Abhijit Banerjee and Ferrara cite as the reasons why long form has some advantages over the short message campaigns. First off, repetitive messages can produce defensive reactions, can produce counter-arguing or a reactive devaluation. Second reason, there is already an overload of messages out there, huge cognitive load on people. And to compete with that welter of messages is a challenge. So longer form entertainment can find an alternative pathway by tying up messages with content that is actually demanded by subjects. Third, long form entertainment programs can showcase an internal consistency between the message and alternative lifestyles that people can adopt. And finally, one of the really important things that long form entertainment programs can do is they can set new empirical expectations. They can demonstrate the existence of alternative social norms, which can then become very compelling for behavior change. So thus, CSBC has created a learning and evidence base for edutainment in India by collaborating with all our wonderful partners on three projects, some of whom are represented here today on today's panel. First, of course, we funded the content and the impact evaluation for an urban sanitation drama with our wonderful partners at BBC Media Action. And what we did was we investigated how can edutainment create a need around an invisible issue. In this particular case, it was around fecal sludge management and how might we galvanize communities to change. The second thing that CSBC did was to contribute to a digital strategy for MTV Nisheth. How can digital and social media complement broadcast TV to increase engagement around the topic of family planning for adolescents? And finally, we also did the impact evaluation. We contributed to the impact evaluation for season 3 of मैं कुछ भी कर सकती हूँ, Makbaksh in short. How can edutainment create new mental models through a role model narrative to improve spousal discussion around contraceptive use and women's agency? That's the sort of the question at the heart of this project. So entertainment education or edutainment is effective and critical for bringing about normative shifts in behaviors. And through our work with partners such as Population Foundation of India, OPM, Quilt.AI, and of course, BMGF, We aim to create a strong process, a theory of change, and an evaluation framework to see whether narrative based interventions impact complex norms around contraception, agency and birth spacing, and their role in changing behaviors. The transmedia initiative of Makbaksh is truly unique and bridges the gap between online and offline and allows us to understand behavior change in edutainment at an individual level. So we have here, as I said earlier, a truly distinguished panel. First, we have Poonam Mutteja, a friend of ours, not merely a partner, but a friend. Poonam Mutteja is the executive director of Population Foundation of India. She has over 3 decades of experience in development, setting up and heading NGOs, contributing to policy and advocacy, strengthening communication for social good, teaching, advising, and mentoring. Poonam has co-conceived the popular transmedia initiative My Kuch Bhi Kar Sakti Hoon, launched by PFI in 2014. So welcome, Poonam. It's truly a privilege to have you here.
Thank
Second, we have Tom Newton Lewis. Tom is currently the chief of strategy and business development at Oxford Policy Management, with responsibility for their international offices, acquisition team, and overall corporate strategy. He has been essential for the designing of the evaluation framework for the on-ground evaluation of Makbaksh. Third, we have Angad Chaudhary. Angad is the founder and chief of products at Quilt.AI, Quilt.AI. They apply human empathy to research at scale by using artificial intelligence, um, AI tools to build a large research and action platform. And that's why Quilt's unique digital analysis of Makbaksh online helps us better understand the nuances in the intervention's impact. And then we have Priyananda, who's been sort of uh, the driving force, the force of nature behind this webinar. And she has been collaborating so actively with all the partners and us in trying to consolidate the learnings. Priya is a part of the measurement, learning, and evaluation team at BMGF, and has been, as I said, an essential part of bringing together the partners on the Makbaksh project. I know she's a health economist and also a scholar. So I welcome you, Priya, and I welcome everybody else. Thank you very much. Over to you, Sanjeevni.
Thank you so much, Pavan, for that introduction. I would now hand over to Poonam to share the learnings from the design, conceptualization, and execution of the multimedia edutainment मैं कुछ भी कर सकती हूँ. Over to you, Poonam.
thank you. Yeah, so I'm very privileged to be with five very eminent key players in the field of behavior change and communication and evaluating and funding. Quite a deadly combination of five people, institutions that have worked together in the last year and a half, and it's been an absolute privilege to have people with the kind of expertise that has been brought to the table, and PFI is very grateful and humbled to have Pavan, for you all to have brought together such a great group to evaluate us, look at our work, and it would have never happened on our own. I have to be very honest. So we really owe you a big debt. So I'm going to start with that and then say that we launched season 1 of मैं कुछ भी कर सकती हूँ in, as you said, in 2014 on 8th March. And for me, the prayer was that a Women's Empowerment Day chosen would be, would truly lead to women's empowerment in this program. So that was season 1. And some of the issues that we focused on, you mentioned, but how we focused on them is through, first, I want to mention that we did formative research. That was the positive deviance approach, which I think made a huge, which was unique about this program. Celebrity messaging and, of course, independent evaluations are very important when you make such huge investments, and we did that. And a AI part chatbot was the end result and came into in somewhere close to season 3. But we, as Priya knows, we did increasingly in season 3 use the digital media, YouTube, Facebook, and Hotstar. We are also on Hotstar, but we used Instagram a lot too. And the community reach of to the NGOs was something that I wish one day we could evaluate, because I believe it led to many we have reasons to believe it led to many movements. And then the interactive voice response system, where I would like to say PFI partnered very closely with Gramvani, and we received over 2 million IVRS calls. And of course, the creative genius, Feroz Abbas Khan. I'm still on the last slide, but that's fine. I'm done. I'm done. Thank you. And so this is the series is really about Dr. Sneha at the center. Dr. Sneha is at the center, a very spirited doctor who gave up her very successful career to and medical practice in Mumbai to review a community hospital, to work in a community hospital, which she revived in Pratappur. This was our it was like the primary health center that we tried to create. And Pratappur, she encounters huge hostility because it is a place steeped in regressive norms, and which totally and clearly deny rights and equal rights to girls and women. But her family supported her, neighbors and unlikely allies came together in the community. She realizes that community participation is at the core of social change, and to promote positive behaviors around family planning, adolescence, reproductive and sexual health, gender equality, hygiene and sanitation. As I said earlier, the director of the series is Feroz Abbas Khan, and it has been who you can see in this photograph. And we were the Doordarshan, the TV channel that we were privileged to be hosted by, and that also gratis, dubbed the serial in 12 languages after they received feedback. I mean, there is no evaluation equal to feedback and demand from the audience. And so it was aired in 50 countries too, because I think Doordarshan felt very proud of doing what they were doing. And approximately, as I said earlier, 2 million callers on IVRS. And of course, it continues to be hosted. It will be hosted for 5 years at the minimum on Hotstar. There is indeed our preparatory work really involved looking at the global evidence from Soul City to favelas across Latin America and a couple of American entertainment education programs. We spent a year doing a desk review and reviewing what the global evidence showed us. We looked at the programs, we reviewed the impact assessments. Many of us together as a group spent a year doing that. We came to the conclusion at the end of 1 year, it was very important to have positive deviant case studies, so which would be amplified through Main Kuch Bhi Kar Sakti Hoon. We did field visits. We did a lot of consultations and planning with experts. We had a very eminent and experienced technical advisory group of 22 people, which included an additional Secretary Health, an additional Secretary Health from the Health Ministry, because we wanted to make sure this would be useful for the government. So we did script reviews and real-time monitoring and feedback. Scripts were reviewed again by the same technical advisory group and experts, which included a range of professionals, and we did detailed and diverse, we used detailed and very diverse evaluation approaches. So the theory of change, Priya spoke about, no, not Priya, I think this is something, no, nobody's spoken about, but the theory of change for Main Kuch Bhi Kar Sakti Hoon season 3, we clearly the overall strategy of developing an entertainment, education, TV and radio serial using a positive deviance and transmedia approach would result. We assume for us from there we would have intermediate outcomes, including positive shifts in knowledge and attitude towards age at marriage, age at first pregnancy, social norms and beliefs around contraception, increase in conversations around family planning, increased knowledge on new contraceptives for spacing. Most importantly, we were looking at injectables that time because they had just been introduced. Improved attitudes of frontline health workers towards sharing information around family planning and contraception. We felt that it was very important not only to change the social norms of the community, but change the social norms and thinking of the frontline health workers. And it was designed that was an intermediate outcome that we clearly had in mind. And the primary outcome of the intervention included creating an enabling environment and accelerating positive shifts in family planning related norms, improving basket of choice. As I said, there were actually three contraceptives that had been introduced. And we wanted to sort of create a demand, shape the demand for the contraceptives, including injectables, increasing evidence to informal global discourses on increased evidence for informed global discourses was another outcome of the entertainment education program. And this would in turn result in the program goal of increased demand and uptake of family planning services. Especially, we were focused on the spacing methods amongst both men and women in the reproductive age. As I said, some of the key themes, in fact, I mentioned earlier, were also included child marriage, delaying pregnancy, male engagement, and so on. And definitely, as I said earlier, attitude of the healthcare providers, especially as far as young people are concerned, and some of the characters that we brought in, and I'll talk about, but Main Kuch Bhi Kar Sakti Hoon purposely incorporated markers, which are words, as you all know, or phrases which have a visual representation and practices that are aligned with the project's social objectives, and were incorporated in the scripts and outreach strategy of the serial. These markers represent I believe, an innovation, and the strategy was not only to promote new social realities, but also track how audience members engaged over a period of time. So the markers developed for season 3 were all strongly rooted in the themes and plot lines of the serial. So additionally, markers also invited and encouraged user engagement in very diverse ways over a period of time, and promoted practices related to delaying marriage, unfolding the career decisions made by women, and symbolically celebrating and affirming their position in society. And the transmedia approach ensured meaningful engagement with markers, using these platforms to encourage and engage in very, very specific ways. For example, asking audiences on the iVeres to finish song lyrics, or asking them what they would do if they were in the shoes of Sneha or Panna. Panna was the Asha, and Sneha the doctor, or inviting them to just share their stories, and on social media puzzles, using social media puzzles, quizzes, memes, contexts, with some prizes also were offered, and these challenges, the challenges invited audiences to think and talk about the issues associated with the markers. And we've listed 6 of the markers here. Mast Petara, which was really the Mast Petara was the the box of different contraceptives. Mastbandi is the word we gave for Nasbandi. And Lambi Sagai was about increasing age at marriage and postponing and planning birth of children. And Aurat Ki Marzi Ka Din was really about Main Kuch Bhi Kar Sakti Hoon, day, which we introduced as a concept of Aurat Ki Marzi, and largely then was about celebrating the birth of a girl child. So let me first, for me, the viewership data is important in not just the numbers. It is important that how, my biggest nervousness was when we designed and launched the show, will men watch this? We needed men to watch it. So when we found almost equal viewership for a program called Main Kuch Bhi Kar Sakti Hoon for both genders, that to me was the biggest accolade and victory and success. I couldn't imagine anything else I wanted once I found that out. So having 48 almost equal viewership, and the digital media, reaching 894 million people, I had not imagined. We had not imagined through the digital media, because digital media was a small, very, very small part of season 1. And ultimately, it was really with the encouragement of many of you, including our donors. I always say, it's not the quantum of funds that a donor gives, and in this case, Gates Foundation. It is the vision and the ideas that come, that really with the money, which make the money much more valuable than the amount. And so the total reach of nearly 30 million and 3.7 million episode views on YouTube. And this is in spite of the fact that we had no money for promotion, very little promotion. And of course, 4 million Instagram sessions. And the chatbot which was first of a kind digital extension of any social and behavior change communication initiative in India. Uh, Over 6 million, it has a 6 million reach within the first 6 months and 1.3 million conversations. And, the day the Ministry of Health and Family Welfare heard, we had gone for another meeting, we happened to mention this. They said, send us all the details of Sneha AI chat. And Government of India, in 1 week, passed a government order to connect Sneha AI to the ministry's family planning helpline, JSK. So, what were some of the learnings from, we are going to hear a lot more, so I will actually say very little, but over season 3 initiative, we've been able to consolidate some key learnings and the importance of positive deviance studies. I mean, the evaluation will be shared by our other partners. The learnings for us, and Priya, you were very keen that we'd share the learnings, and we are delighted to, but I have time for just 6 learnings, which I will share. The importance of positive deviance studies to ensure that the character and storyline are not only credible and aspirational, but, one of the feedback in the focus group discussions we kept getting is that what was shown in the serial is doable for the community. They found it very easy to start movements, take action, and so on. And the community and family engagement through the multi-generational viewing to improve engagement and encourage the conversations on otherwise sensitive issues. So to hear about the young people, 40% of our viewership was young people, and a very large percentage in the focus group discussion said that they could have conversations. The way the serial was designed, it led to conversations on very sensitive issues with parents. There were conversations between mother-in-law and daughter-in-law triggered by the serial on family planning. And viewers and listeners clubs were critical to increasing the viewership and for providing spaces for younger audiences, especially to engage with the issues raised in the serial. Markers were to be built into scripting and outreach to better measure message recall, because the message recalling on the markers is clearly something that I am sure has been there in many other entertainment education programs, but they weren't measured perhaps. And this is the first time they were measured. A transmedia approach also ensures, we believe, that multiple audiences through diverse media and platforms can be reached through the serial. And of course, finally, the digital platforms and on-ground outreach are very essential, as I mentioned earlier, to encouraging audiences outreach through quizzes, challenges, context, etc. So so thank you very much for the opportunity. And I'm very, very much looking forward to listening to the more, to the evaluation by our partners.
Thank you so much, Poonam, for sharing the learnings from the conceptualization of the intervention. And just taking the conversation forward, I want to emphasize on the importance of developing a learning agenda and evidence base around edutainment. Since we at CSBC were inspired to understand what works and how for long format edutainment interventions, the evaluation of the Magbaksh intervention was an exciting opportunity for us. We believe that it's absolutely critical to synergize the practitioner and the implementer's creative vision for the interventions with the learnings and expertise of researchers and scholars. We have worked closely with the PFI team in the past to understand their theory of change and their vision for this intervention. We strongly believe that it is crucial for both parties to work together to understand the objective and the scope of the intervention and the extent of its impact. The evaluation design should be aligned with the expectations from the program. What is interesting here is that the two Magbaksh evaluations from Quilt and OPM focus on two very different spaces of impact. While OPM's results show an on-ground impact of the television show, the results from Quilt provide the additional nuance that bridges the gap between personal and social. These also provide insights on how we can harness the growing power of digital and social media to uniquely complement the broadcast television. Just taking the indicators and the ideas that Poonam mentioned forward, through the medium of these evaluations, we aimed to understand the influence of the intervention on key knowledge, attitudes, and practices in sexual and reproductive health and family planning. These shifts, these would include shifts in knowledge, attitudes, and practices related to age of marriage, age of first pregnancy, and usage of contraceptives amongst the target audience. We also wanted to understand how this show encouraged increased conversations about family planning among spouses and family members. The focus of these evaluations was not just limited to the knowledge and attitudes pertaining to sexual and reproductive health and family planning, but also to identify and understand the prominent patterns of behaviors across various groups in society. This is primarily to build the evidence base and understand how the audience engages with the content and what their behaviors and attitudes are in real life. For example, gender, age, education, and socioeconomic status play a significant role in determining the agency in decision making. As the age and education level increase, the agency in sexual and reproductive health behaviors increase for all socioeconomic groups and for all genders. Additionally, there's also an interest and need for programs and interventions that focus on disseminating reliable information on these topics to guide individual actions. Online searches indicate that individuals are more likely to access YouTube and Google to gather information on family planning and sexual and reproductive health than speak to peers, family members, or frontline workers. The two evaluations from Quilt and OPM complement each other and provide holistic insights that align with PFI's vision for the intervention's impact and contribute to the interpretation of the results in a constructive manner that help the sector and future edutainment initiatives. So with this and the excitement to build this evidence base, I would like to hand over to Tom and Angad to walk us through their evaluation results and share the insights. Over to you, Tom.
Thank you, Sita. Great. So firstly, just to start by acknowledging a large number of people who've worked on the evaluation. This is a very collaborative piece of work between OPM, PFI, obviously CSBC and the foundation. Lots of shared thinking went into the evaluation, both in terms of how to operationalize it, but also how to measure some of these constructs. So this has been a really sort of genuine collaboration. And secondly, to acknowledge the large OPM team who worked on this and led on this work, some of whom will be dialing in to this webinar at the moment. Great. So to jump into the evaluation design, I mean, the mandate that we were given by CSBC was both to look at the impact of the show on some of the outcomes that Poonam set out that they were trying to influence, but also to try and unpick the black box a little bit of how exposure to the show and the associated interventions led to changes in some of the outcomes. To do that, we've put a bit of sort of conceptual theory behind it, leveraging social cognitive theory that looks at the determinants of behavior and groups them into three areas: cognitive, behavioral, and environmental. So we've tried to use this as a prism through which to unpick that black box, to see exactly how and why behaviors are changing. And we'll come back to this in the main presentation. The evaluation is organized around the theory of change that Poonam set out. In particular, 6 or 7 intermediate outcomes. We've tried to trace through how different messages within the show focused on different target groups. I think that's an important point. This is quite a complex show. There's slightly different messages going to slightly different viewers, targeting different parts of the spectrum. We've tried to trace that through, how that's led to narrative engagement based on the social cognitive theory, and how that's translated through into outcomes. So the detailed evaluation report is organized along this framework. Obviously today we're just presenting some highlights. In terms of the evaluation design, this is a very difficult type of intervention to evaluate because it's very hard to predict in advance who would watch the show normally. India is a very fragmented media landscape. So in real words, it just means there's a very large number of TV channels. So it's quite hard to know exactly who will be watching a particular channel at a given time. So we had to use some kind of experimental evaluation design where we identified the kinds of households that the show was most trying to influence through a listing exercise, socioeconomic category C households. And then we randomly allocated them to treatment and control groups. And to ensure that the treatment groups ended up watching the show, we gave them a financial incentive, 250 rupees. So on the expectation that those who would receive the financial incentive would end up watching the show, and those who didn't receive the financial incentive probably unlikely to watch the show in large numbers. We surveyed these households before and after the show, which means that we're actually able to see how some of the outcomes change over time as a result of being exposed. And this allows us to have a reasonably robust gold standard evaluation model that allows us to isolate the causal impacts of the show on some of these outcomes. And this is one of few global examples of this kind of prospectively designed robust evaluations related to these kind of edutainment interventions. What we found, so we'd expected that the financial inducement, the 250 rupees, would be sufficient to ensure that large numbers of the households allocated to the treatment group ended up watching the show. It didn't quite work out perfectly in practice. We don't think that was necessarily because the financial inducement wasn't large enough. What we found is that there are actually quite a lot of practical constraints to these particular types of households watching the show. And actually only a relatively small proportion of those who were incentivized to watch the show actually ended up being exposed to it in the evaluation. The most practical sort of constraint on this was for these particular types of households, we found that they actually tend to have a reasonably early bedtime, which is something we hadn't fully anticipated. And the show's timing for lots of households was at a time after they'd stopped watching television and gone to bed. So that, I mean, that's a lesson for future series of the show about the sort of ideal timing. For the evaluation, that left us with a slightly smaller treatment group than we'd expected. It was okay. We still had enough numbers to be able to do a meaningful and robust evaluation. We weren't able to do all of the subgroup analysis that we'd hoped for because we had a slightly smaller sample. So we weren't sort of fully able to interrogate how some of the findings differed by gender, education status, et cetera, et cetera. It also meant we had to do some sort of very geeky statistical adjustments to ensure that we were restricting the match between those who ended up watching the show and people in the control sample who were similar to those who ended up watching the show, not the whole control sample. I won't go into the boring details, but there are some sort of fairly established statistical techniques for doing that kind of matching that we've deployed. Okay, so to get into the findings, so to start from some of these proximate outcomes around narrative engagement. And just before that, to jump into some of the viewership figures. So this isn't from our evaluation. This is from the Broadcast Audience Research Council of India. Their figures for actual whole of India viewership of the show. So we see a couple of things here. So one is that viewership of the show bounced around a little bit. It peaked at over 1 million viewers per episode. For Rajasthan, which is where we targeted the evaluation, viewership was probably relatively lower than we'd expected. We also find on the bottom chart, which shows the sort of average number of minutes people who watched the show ended up watching the show for, also bounces around quite a bit, particularly in Rajasthan. So the takeaway from this, which we'll come back to at the end, is that people who are watching this show, who are exposed to this show, don't end up watching every episode, and they don't end up watching every minute of every episode. And we'll come back to that theme towards the end of the presentation. I think it's quite hard to interpret sort of how much of a success some of these figures are. I mean, I think over 1 million viewers per episode is a very large number of people, and of course the sort of broader exposure figures that Poonam set out in her presentation are very encouraging. So back to our specific evaluation sample. I mean, to try and unpick this black box, we developed a more granular model of how exposure to the show translates into changes in knowledge, attitudes, practices, etc., by breaking down narrative engagement into various concepts. And we try to trace these through in the evaluation. What we find, some of the big takeaways is, so firstly, the people who watched the show really enjoyed it. So very high, strong user feedback. Those who watched it, they enjoyed it, they found it funny, they found it entertaining. They said they would like to watch more episodes in the future. They particularly appreciated the main character, Dr. Sneha. So, you know, some really positive feedback for those responsible for storyboarding and designing the show. Also, some very positive and encouraging findings. Nearly half of those who watched the show said that they learned something new about family planning as a result of watching the show. A lot of them said that they intended to change their behavior as a result of the show. So very, very encouraging in terms of the theory of change. There's clearly sort of latent demand for this kind of information. Those who watched it liked it, learnt from it, wanted to have more of it. Some of the maybe more challenging sort of findings from this is it relates a little bit back to this fact that not everyone watches every episode and every minute of every episode. We found that specific recall of individual episodes was fairly low, and some of the markers that the show had set out. You know, overall, this sort of leads into a finding that's backed up by the rest of the presentation that, you know, in general, because people enjoyed the show, they got the intent of the show. Some of the sort of bigger messages they really internalize. Some of these more granular messages that are maybe dotted in a couple of episodes were harder for them to take on board. The other possibly challenging bit of feedback is, I mean, there's some creative license in the show, obviously, that's what makes it entertainment. But I mean, there was some feedback that around the perceived relevance, that viewers found that the village under depiction and some of the characters not necessarily very realistic for the kind of villages that they live in. But overall, I mean, with those caveats, very positive, lots of very positive feedback from the show. And you would expect, because of this, to see the translation from exposure through to changes in some of the outcomes because of this strong narrative engagement, which in many ways we do. So to jump on to some of the actual sort of further outcomes, this was organized around the outcomes that Poonam set out. I think just to acknowledge again here that these are targeted, these are slightly different types of outcomes: knowledge, attitudes, conversations, going and finding out more information, talking to community health workers. And some of them are targeted a little bit at different target audiences, which has been slightly difficult to unpick in the evaluation. Some are targeted towards unmarried youths, newly married couples, parents, men, women, etc., etc. So there's a lot of complexity here, but we've tried to the extent possible to explore all of these. So, I mean, before I go into the sort of real detail, I mean, the sort of real highlights. I mean, I think there are 4 big areas that come out from the evaluation of having really large, statistically significant positive improvements as a result of being exposed to the show, and things that the program and the team behind it can be very proud of. So firstly, amongst people who watched the show, very large increases in the probability of talking about family planning after watching the show. So 10 or 11 percentage points. So that's 10 or 11% of the whole sample who ended up talking about family planning, who would not have done if they'd not been exposed to the show. And even higher in terms of then going off and using social media to find out more information. So again, there was obviously a lot of latent demand for this kind of information. It's triggered conversations. It's triggered people to go out and find more information. So that's really positive finding for the theory of change. We find that it's also led to behavioral intent, particularly around birth spacing, a little bit about delay, age of first pregnancy, but mainly around appropriate birth spacing. So very large improvements in those who intend to leave at least 3 years gap between births. Increased knowledge around particular methods around birth spacing, particularly around injectables. We also find behavioral intent in terms of then going and following up and visiting healthcare providers to talk about family planning or receive family planning services and products as a result of watching the show. So these are the 4 big things that the show, we saw really big, statistically significant and impressive effect sizes on as a result of being exposed to the show. So I mean, this is sort of really positive results. I'm now going to jump a bit more into the details very quickly, but what I'm going to do over the next few slides, and I won't dwell on them, is to show for these 7 7 outcomes that the show was targeting. For each of the dimensions of the social cognitive theory of change, these cognitive, behavioral, and environmental factors, bless you, which have shown a significantly positive impact, and which we haven't seen a statistically significant impact. And then a couple where we didn't really have enough of an evaluation sample of that particular subgroup to be able to make an evaluative judgment. So before I jump in, I will say there's a lot of yellows on the slide, on the subsequent slides. I think there's two things to think about that. One is we've looked at every dimension of the social cognitive theory for every indicator. And obviously the show is only targeting a subset of those. So in the subsequent slides, there's a little sort of arrow and target sign for those that the show was really targeting. But we've tried to look at all of the other dimensions as well to really understand the broader effects of the show. And secondly, I mean, this is also a learning exercise. You try lots of things. You try and influence a lot of these things without sort of necessarily being particularly confident up front about which things are amenable to change through this kind of intervention and which things aren't. So you would expect to see some things change and some things not amongst these indicators. So just to go through quickly, we found some of the outcomes around child marriage and delayed age at first pregnancy are quite sticky. We didn't see much of a change. As I said in the overview, what we really saw was the particular sort of cognitive aspect around spacing at birth that the show focused on. We did see really significant changes. We didn't end up with enough of a sample to be able to make an evaluative judgment about impacts on young married men. In terms of conversations, we saw big impacts on the sort of behavioral side of conversations about actually people after watching the show going and talking about family planning and its issues with their peers, with their spouses, where relevant, with their family, and going and availing more information. We saw a big increase in the knowledge about injectables, less so about some of the other bits of knowledge, some of which the show targeted and some which didn't. And we didn't have enough of an effective sample to say much around follow-up engagement with community health workers. So, I mean, again, if I was to jump back a few slides, I would reiterate that 4 or 5 really big, impressive improvements as a result of the show, but also things that didn't change. Partly that's because, you know, we're learning through this about what is amenable to change, what isn't. Partly some of these indicators already started from a very high base, so it's actually quite difficult to change them further. Some of these indicators are actually, I think we learn from this and other factors, just very difficult to change, particularly those that rely on sort of broader social norms that are less amenable to changes in individuals. So some things changed, some things didn't change, but overall, I think lots of success to celebrate and be very positive about. And just some more nuance around this. I mean, we found that levels of education and levels of sort of economic agency of women played a role in how impactful the show was to them. So I think that's an important learning. And then the second one again, just to reiterate this point, that we found less traction in the kind of behaviors, knowledge, attitudes, etc., that are more situated within broader social norms and less amenable to change at the individual level. And, you know, to change social norms, you'd have to have sort of lots of people in the same village or environment being exposed and affected at the same time, because this shows sort of effective coverage in a particular geographic area is not necessarily that high. And it's probably unrealistic to expect that we can change sort of broader interdependent social norms. So in terms of sort of future recommendations with that in mind, I think one, we made some recommendations about how to improve viewership of the show. As I said at the beginning, particularly thinking about the timing of the show. If you're targeting a certain demographic of households who seem to have an earlier bedtime than we'd necessarily understood. Poonam talked about how successful the chatbot had been, and that definitely came out also in the evaluation. And I think there's sort of even more synergy that could be achieved between the chatbot and the show, and promoted on the show, and that's something that they can build on further for future seasons. The other sort of key takeaway, and it loops back to the thing we were saying at the start, that not everyone who watched the show watched every episode and every minute of every episode that they watched. As a result, we think that the show probably tried to do too many things, slightly too many characters, maybe too many messages. You know, we find that people were able to take away some of the simpler messages that were quite repeated, but maybe harder to internalize some of the more specific, granular messages. You know, as makes perfect sense. Future episodes or future series of the show may want to think about rationalizing down, focusing on fewer things and making sure that they stick. And finally, you know, as Poonam talked about in her presentation, they've got lots of traction through some of the sort of associated events and interventions around the TV show. That's great. Need to do even more of that, I think, going forward, particularly in terms of on-the-ground activation to help people who've been exposed to the show translate sort of changes in knowledge and attitude into behavior. There are possibly things that could be done on the supply side, particularly around community health workers, to deploy them to help households who are exposed to the show to follow up on it. And again, just to reiterate the sort of potential effectiveness of the chatbot. It was a very exciting and impressive innovation for this show that's clearly got a lot of traction. So overall, you know, some very good news. Some of these really hard family planning indicators, we did see really big shifts in as a result of people being exposed to the show. People enjoyed the show, they wanted to see more of it. So lots to be very proud of for those behind it. And I think some nuance and some recommendations also come out from the evaluation about how it might sort of want to be refined and iterated in the future, but not to take away from some of these very positive findings. Thank you.
Thank you so much, Tom. With this, I'm going to hand over to Angad, who will share the findings from the digital evaluation. Over to you, Angad. Sorry, Angad, I think you're on mute.
I'm just trying to find the remote control. Thank you. Good evening, everyone. My name is Angad, and I'll be walking you through what Quilt.AI did in assisting this magnificent behavior change effort. The center met us about a year and a half ago and requested us to understand whether there was a digital impact that the intervention had. Now, digital impacts are often studied through shares and likes and engagement and views, which is a valid method of studying them, but with something that was designed as an intervention to change attitudes, to shift norms, we wanted to find an appropriate space in which we could measure that. We found that in search engines, and we worked with the assumption that if someone has watched an intervention or engaged with an intervention that is pushing them in certain directions to break away from ideas about patriarchy or ideas about sexual and reproductive health, if those interventions are successful, then perhaps one way in which we can measure them is if that individual uses their phone and searches for some of the ideas and concepts that have been seeded through the intervention. Along with that, we also did a survey. These numbers seem high, but they are only high because the internet allows us to reach scale that offline sometimes cannot. There are, of course, scale advantages to this, but many disadvantages as well. We want to be very clear about that. Think of these numbers as indicative and the results as indicative of what people thought. So that was the way we did the survey. We bid on approximately 6,000 keywords. Those keywords were related in both English and Hindi, and they were related to the multiple concepts that the show was seeding. So for example, if the concept was around, in quotation marks, girl child, then the keywords would be around women's rights, uh, the keywords be around trying to get a male child, when you are attempting to conceive, etc. So we collectively designed 6,000 keywords to go fairly large. Based on this, we had about 113 million searches over a large period of time. So just to clarify, we tried many different strategies of evaluation. The only one that had an actual engagement with potential viewers and therefore a human articulation was the survey. Everything else was purely observational. What I'm going to do first is I'm going to walk you through the way in which we selected the 5 of the 52 that were the highest performing. Now, if you would be patient, I will just walk you through the basic principles, which were, let's say you as an audience have not engaged or seen this intervention on the 1st of January. We look at all of your search patterns uh, for the past 1 year, and we get a sense of the seasonality and the frequency of those search patterns. We also look at other states as well as pan-national search patterns along the same period to see if they're all behaving in similar ways or not. Then once the show is launched on a particular date or consumed by a person, we see that same population across those multiple cities and states, how their search patterns evolve. And we look at those immediately after the show, as well as immediately after the entire intervention is done. We compare that with, of course, uh, uh, parallel states as well as pan-national. So I'll walk you through some of the findings of what happened. Some of these numbers seem extremely low, but you are changing a fairly complex and deep-seated set of behaviors. The first thing to look at is there is a release date in the top left of this document, as well as some of the analytics that are given to us by both YouTube and Bark, which is the digital as well as the terrestrial spread of the show. On the first column, the top keywords column, these are the words, now we've translated them into English here, that were the highest performing and highest growing in the entire category of condoms. And this and these are the top ones of all of those that were around condoms. The average before date is how many people searched for that per month. So it was about 2,070 for the first keyword. The average on date per month is 2,300. So you've seen a little bit of a jump in the week right after the show. And average post date is 2,325, which is after the entire intervention. Now, all of these are interesting numbers, but the way we've managed to control for whether this is a natural growth or not is we've looked at how uh, uh, the entire nation has grown as well. So if you've seen, these numbers have grown by about 0.12, national has gone by 0.03, and then we calculate the difference between all of our cities where the content was exposed versus pan-national. So two interesting keywords really stood out here in context of the nation. One was best condoms and order condoms online. So we ran this through multiple shows. So here we've seen advantages of injectable contraceptives and side effects of injectable contraceptives increasing. But again, the base is like 13 and 2. In this one, we've seen certain searches decreasing, which is how to conceive a male child and male child preference related content decreasing, which is important because that was the outcome we were aiming to drive. Mid-surround mensuration, of course, was one of the largest growing concepts in general. And one of the reasons these numbers on the right are so small, but we're calling it out as a large growing concept, is I want you to look at the YouTube views here. So if the YouTube views here are 24,000, but we've had almost a jump of 1,600 searches. That means we've had a fairly, almost 5% of the people, if you were to do some rough back of the envelope calculations, were impacted by this. But if you look at some of the others, the views are 36,000 and the jump is maybe 100. So just to give you some perspective on how the biggest mover in our opinion was around this particular concept. Once we had done and aggregated all of this information, we then decided to not treat each episode as a singular entity because we worked with the assumption that the intervention was 52 episodes. And we looked at how all of the keywords as an aggregate moved in the entire intervention period with the assumption that they were probably being repeated and therefore repetitive impact was changing some amount of thinking. Now, I'm going to show you two slides, and I forgive the busyness of these slides. The first one is measuring all of those keywords and concepts compared to the national average. So episode related are words like Dr. Sneha, how can I watch MKB, KSH, how can I, episode related. So please don't focus on those too much, but look at words like injectables and all the sub keywords related to them or celebrating girl child. They moved 27% greater than how the national average was moving. So we believe that abortion education, women's equality, and injectables in the broadcast states moved faster and higher and grew faster than in the entire nation. Once we had put this together, we then decided to not only look at the nation because it's very unfair to compare all of the states as one set. We looked at neighboring states in order to see how neighboring states where it was not broadcast at this intensity, what moved up and down. And again, similarly, we saw STT-related information, puberty-related information, condoms and injectables, etc., and male-child preference were the key concepts that shifted. So in summary, and if you are only to look at search and you believe that behavior on search for our segments is in somehow impacted by our interventions, then we can conclude with many, many qualifications that we have seen shifts in sexual and reproductive health as well as women's rights, even if it is a minuscule percentage from in the context of a pan-national in the context of pan-national behaviors around the same. And if you were to compare it with neighboring states, we've seen a shift in sexual and reproductive health related conversations with a special reference to sexually transmitted diseases, condoms, and injectables. There has also been some growth in girls searching in these states, higher than the states next to them in interest in puberty and knowledge about puberty. Now let us get to the survey results. And once again, the search behavior is observed behavior. This is declared behavior. So we did not have a very sophisticated method here, like the previous presentation. We just asked a bunch of questions to people that we targeted or retargeted. So please treat these results with that context. Our sample was fairly large if you compare it to offline, but pretty average when you compare it to an online sample. And we looked at uh, people in Rajasthan, UP, and Bihar, and we targeted to MK viewers and non-MK viewers. We targeted the MK viewers based on multiple criteria. So we had a retargeting and remarketing list that we managed to extract. We had Facebook analytics and other analytics that were provided to us, and we used that in order to extend. So that was one way in which we did it. And the second way we did it is through opt-in questionnaires and some questions inside the survey itself. So that was the set. And the second set, which is people who haven't watched, was quite unglamorously just an exclusion of the first set. So that's how we did that. Um, So the headline here is that there's actually no difference in claimed social norms between viewers and non-viewers. So while it's very promising to see young girls and people who have watched the show searching for injectables and searching for menstruation related products or just curious about their bodies and uh, sexual well-being, we've noticed that ideas around marriage perceptions, ideas around family planning, they were fairly similar for both sets. There were some skews here and there, but we didn't want to call it out as massive because we felt that it was probably just some noise in the data. The headlines, of course, are people believe that boys should get married under 26 and girls should get married under 21. Uh, Men believe that they should have children within 2 years of marriage. Uh, Very few women use the pill, and only less than half of older men claim that they use condoms. There's actually no conversation around STD and disease when you ask them, and 20% do not use contraception at all and rely on safe, period timings and pull-out methods. The reason we've stated all of these is because from some of the other work we've done for other partners, this seems fairly normative for a mass market set of perceptions, and the differences between viewers and non-viewers here is negligible. However, we also asked them about how they engaged with the show and what they thought about the show and what their experiences were. The one interesting barrier, that's a much longer survey, so I'm just highlighting some of the key points, but the one major barrier for a lot of them was that they believed it was a little didactic. They didn't, of course, use that word. It was a survey question and an option that they had. And so they reacted in that particular way. And they claimed that that was the reason for either not watching it or their own criticism of the show. Amongst the regular watchers, the key triggers were, of course, some of them claimed that it helped them think about the community and issues inside the community. The women appreciated the focus on women's rights. The younger people appreciated the focus on the legal age of marriage, and uh, everyone really loved Dr. Sneha and relationship with Arjun. Now, this is known to us, but I think the one feedback that I would take away from here, and again, these are internet savvy people who, even though they access the internet for a few moments every day, potentially, are exposed to a vibrancy and range of content. And I think that is the reason perhaps some of them felt it was a bit uh, didactic. Again, it was an option we gave them in the survey. So in order to explore this further, this is a bit of a crazy chart, so please forgive me. But in order to explore this further, we took the high performing shows and used a machine to recognize each and every object inside inside each of the frames. So the colors, the tone, the objects, the shapes, the lighting, the background, the foreground, the characters, etc. And what this allowed us to do is to computationally look at every signal that the show was putting out there. We didn't rank these signals in any way. We just wanted to get a sense of what was the, in quotation marks, vibe of the show. And we found that there was, you know, there's very few distinct clusterings and groupings that popped inside the show. And though they were around the formal scenarios, some celebrations, and lots of monologues, and this stood out to the machine. And the reason we bring this up is because it shows you that in the dross of the entire show, the machine believed, and this is not a human, that there was only 2 or 3 interesting moments of differentiation. Then we ran one of our custom machine learning models that also looks at each image and gives an emotional score to it. And it does this by taking that image and hitting it against a database of images that represent emotions. So bright images represent positivity, darker images represent negativity, groups of people laughing and dancing represent, joyfulness, people holding hands, walking through the sunset represent romance. I'm being a little superficial about my descriptions, but only to give you a sense of how they work. So each image again of the show was hit against these databases of images, and you can see that we've selected 3 shows here. And frame by frame, you can see the flow of emotions that the machine is picking up are fairly um, consistent. The peaks and troughs move in the same way. The intensity of the emotion moves in the same way, and these 3 rows are 3 different shows. Now, we rarely see that in our experience. So what this represents to us is consistency and a certain systematic emotional journey that people who watch the show are potentially exposed to every time they engage with it. The one criticism we would have here, and it's something to think through, is uh, consistency is very important when you're delivering certain types of messages in certain mediums, but is sometimes problematic in mediums like the internet, where dynamism, stimulation, multisensorial, uh, tremendous variation in emotions are experienced by the viewers. So I think to conclude, from our perspective, we believe that those small shifts in search represent signals and signs of something that we can actually take home. So it's a very hard set of biases to change. It's a very a heavy cultural weight that you're trying to move. And even small incremental shifts like 1%, 2%, 3%, while they might not be headlines and they might not be large numbers, they prove to us that communication, content, and a certain amount of consistency and engagement with people uh, helps them change their minds about things that they perhaps believe are natural and culturally fixed. Thank you very much for your time.
Um, thank you, Angad, and thank you, Tom, for presenting the insights from the evaluation. I am now going to hand over to Priya to moderate the question and answer session and just give the closing remarks for the webinar today.
Okay, thanks a lot, Sita, and thank you for the panelists. It's really, I mean, I've heard these presentations several times, but it's really nice to hear them together today. So there are several questions from the audience, but I think your teammates have been actively answering. So I'll start with Poonam. I'll take one question from the audience and one that I already had. I mean, Poonam, you've been doing this over 3 seasons. The third season is distinct because you've really gone transmedia and you've been very creative in following the user, because the user is really journeying multiple mediums, and what you've done is you've kind of tried to accommodate and factor that in your design. So how do you see this season as distinct in terms of what you see as impact from season 1 and 2? Obviously you've changed the content, but I'm thinking, like, if you just zoom out to the broader kind of ideas that even Angad was talking about as he finished, what do you see as a big difference? And then secondly, there was a question from the audience: were there ways that you looked at any mid-course design accommodations or shifts, because actually you added some of these digital interventions along the way and they were not necessarily there at the beginning? So if you can just talk to these two things. I mean, I think Mandira has answered some of the questions around gender data of users. Thanks. Poonam, you may be on mute.
I think Mandira also answered the question on mid-course corrections,
Okay,
but I'll
fine.
deal with it too.
Okay.
So, so what are the big differences we observed? We're really talking about between season 1 and 2 and season 3. Season 3 is where a lot more of the transmedia approach came. But you know, I mean, I was looking at the evaluations and I'm reflecting on many things, and so my brain is going right now at full speed, because I have not seen these presentations before, while you've had the privilege of seeing these presentations, and I'm really interested and curious, and you know, there is so much to learn and so much to think. So between season 1, 2 and 3, well, there are 2 or 3 things I'd like to say. That yes, one change we saw was the timing. And I want to deal with that. You know, the timing changed. And the timing changed because elections came when the launch was happening. And elections came, so they were suddenly announced. So we had to change because everything was focused on elections. And when we changed the timing, we could not get, Doordarshan had already committed 7:30, so we got a much later timing. So that was the big change that we have to keep in mind when we talk about season 1 and 3. And the demand for change came from, you know, a combination of from conversations that PFI and Gates Foundation had, where they felt, you know, another program which had already gone on air wasn't doing so well in terms of the numbers. So they were nice enough to warn us. And so we really appreciate it, but we lost on the timing. So the transmedia approach was built on from the very beginning of the serial, but much more in season 3. And the transmedia approach has allowed the serial to reach audience that may not have watched the serial. So a lot of the people that Angad reached out to would not have been watching the serial or he surveyed would not have been watching the serial. So it was the first time, it was an introduction to a different kind of audience. And, you know, while listening to him, I realized that that was not the audience we were really addressing to begin with. So, and I mean, the program wasn't designed for that audience. We introduced, and I'm glad we introduced, but there's learning there, and I'm just trying to process that. So allowed us to reach audience that may not have watched the serial or heard the radio version. And expanding to digital platforms has ensured that the serial reaches a wider range of young people, especially, you know, the AI, and even otherwise. We all know that younger people are more on digital media. So we are very happy that there are young people watching. The percentage of both men increased in season 3 compared to season 1, as well as young people watching. And many of their audience include first-time social media users. So that's also, it tells us about opportunities for the future. And the chatbot has specifically allowed PFI to reach a whole cohort of young people on issues of adolescence, reproductive sexual health in a very safe and non-judgmental environment, which does not exist and which we know inhibits young people from, even the government clinics and private clinics and so on and so forth. It provides a private space for audience to seek out information, which for us is a great experiment, and we hope to take that forward a lot more. And an important and effective medium of transmedia intervention is outreach activities with community on the ground. This was effectively used in season 1 and to some extent in season 3. The formative research and robust evaluations were necessary in ingredients in all seasons, which showed consistent positive outcomes on various performance indicators. And IVRS consistently showed a huge response to the audience.
Thanks, Poonam. Tom, I'm going to ask you to comment on my question, which is really if you had to rethink of the design of the intervention, evaluation, what would you do differently? I mean, obviously, you may have more information around user viewership, perhaps, but outside of that point that you've already made, what would you do differently? And also, uh, do you like can you just talk, there are some people who've talked about selection bias, how was it addressed in your evaluation? So can you just talk about that? And another question to you is, are there parameters in the evaluation where there was an observed change, not just in the intent but actual practice? But perhaps Angad could answer that, so you could take the first two questions that I talked about. And actually, I have a broader question, because there is this idea, it's coming in even from the audience, about it's only 14% of your sample. And we had this discussion the other day between effectiveness and efficacy. And so if you can just talk a little bit to that, why do you think these results are profound? You made that point when you were making the presentation. So over to you, Tom.
Sure. Some tough questions. So I think in this type of evaluation, because people are free to watch the show or not, it's quite difficult to. It does make it very tricky on a technical level to do an evaluation because of that self-selection bias. There are reasons some people choose to watch the show, and there are reasons some people choose not to watch the show. And to sort of strip out that sort of latent interest in watching the show amongst those who watch it compared to the impact of the show is methodologically quite difficult. What we've done through the kind of encouragement design is isolate a group of people who wouldn't have watched the show normally and sort of induce them to watch it through the financial incentive. Now, through the kind of statistical adjustments we can make, and the fact that we've got before and after data, we can be sort of fairly confident that the impact that we measure for those 14% of households is genuine, right? So, the sort of internal validity from a technical perspective of the evaluation is quite high. This is still a fairly robust evaluation for those 14% of households. What this kind of experimental evaluation that takes households who wouldn't have watched the show naturally and sort of makes them watch it, what that doesn't give you is absolute confidence that you get the same kind of effects for households who would either watch the show naturally or other types of households who wouldn't watch the show. So what we can say very confidently is these effects that we've measured are sort of precise and robust for these particular types of households that we've covered in the survey. We can't necessarily be sure that you'd see the same kind of effect sizes for other households, including those who watch it naturally. So that's a that's a natural limitation of this kind of experimental evaluation. But it's the only kind of evaluation that you can really do for this kind of intervention in such a fragmented media landscape. So, I mean, there's some sort of geek technicality in that, but essentially we're saying that it doesn't necessarily mean that if lots of other people watched it who didn't watch it, you'd have exactly the same effect sizes that we measured, and that remains a limitation. On the sort of second half of the question, you know, we evaluate a number of family planning interventions, different types. It's notoriously hard to see change quickly in many family planning indicators, sort of uniquely amongst health indicators. These are very large effect sizes that have been detected. I mean, the sort of increase in knowledge around injectables, for example, has a very, very big increase. You know, much more so than other things that we've evaluated in India and elsewhere. So I think that gives us some sort of confidence in a judgment that these are impressive effect sizes. I think the other thing that gives you confidence is that you see a sort of convincing story all the way through. People who watch it, you know, they tell us they like it, they've internalized it, they've learned things, they want to see more of it. All of the sort of theoretical pathways to changing some of these outcomes you see being ticked off, and then you see these changes in outcomes.
That's the consistency point that Angad also picked up on.
Absolutely, yeah. And that came out very clearly. So, you know, so I think that gives a lot of confidence as well. But as the question in the chat, I mean, because we did the evaluation sort of straight after the show stopped airing, we can measure changes in knowledge and attitudes in conversations. It would need a longer gestation period to see whether actually the sort of change in intent actually translates into change in behavior. Maybe in a year's time, we could do a follow-up with the same households to see whether they actually did what they said they intended to do. And that's something that is a big gap in the overall evidence base, and another limitation of this kind of evaluation.
Great. Angad, if you can just very quickly reflect on, I mean, one of the things which I find very intriguing is that search is a behavior. And I think when we talk about behavior change, to me, what you've changed is my paradigm around thinking about this. So I think what I'd like you to very quickly talk about is how there is a lot of data that exists on various mediums that we are using, which are not being harnessed, and where do you think is the power of that in terms of our own evaluative work around behavior change and norm change? So if you can very quickly talk about that, because the question really is, are there indicators that we should be measuring and tracking around this? So, you know, I think your presentation actually encapsulates it, but perhaps you can just make a pitch for that. And I'll, in the meantime, look if there are additional questions to you. Yeah.
Sorry, Angad, I think you're on mute.
I think Pavan is the one who first introduced the idea to me that search can be classified as a behavior and should not be thought of as a digital thing you do. And that also changed how I thought about this entire interview a few months ago. So credit where credit is due. You know, if you just take a very human experience of anything, you know, when you are deciding to, for example, get on a new diet, or you are deciding to go to a new university or find a new route to your office, or perhaps thinking about quitting your job, or perhaps figuring out a new way to impress someone you're going to meet that evening, we find that in a digital universe, that conversation is happening not amongst friends, but between you and a search engine. And a search engine is not only Google, but it is also YouTube, and it is also Bing, and it is also Twitter search. So searching is a very powerful activity that defines how we are engaging with this vast pool of information called the internet. And we often think of social media, which is expression, being the core activity here, but fundamentally it is people asking questions, people figuring things out, people trying to confirm if things are real or not, people trying to learn new tips and tricks, etc. And I believe that knowledge is, knowledge is the first I don't know the word for it, but it's the first signal of something that is going to change in your attitudes and activities. And that's the assumption of even doing an intervention like this, because you're seeding new ideas and seeding new thoughts. And if the people are internalizing them and questioning them further, it tells you that definitely something is happening. So that's the answer to your first question. And the answer to your second question is, what should we be studying? I believe a couple of things. I think search and social, of course, but we also have to keep in mind that the information people consume and are surrounded with, apart from your content, is very, very key. There is a filter bubble of information that we all are surrounded by. And if your content is not fitting into that information ecosystem aesthetically, semiotically, like we've seen, then the chances of it being rejected are much higher. So we need to proactively study what sort of information genres are circulating around our target groups' worlds, and we have to either uh, fit into that or take a actively counter view on that. So the information ecosystem is and the content that's already surrounding them is something very important to study. Their search is important to study. Their browsing behaviors are important to study. So like lots and lots of things. Um, we're very excited by the promising results that we've seen here. Again, it's so easy to make people buy shampoo and washing machines. It's super easy. The big non-profit world has figured that out a really long time ago, and they use the same ecosystem of monitoring search, bidding on things, redirecting traffic, making sure that things are coming into your timeline again and again, showing one influencer with a great story, etc. And really, I think adopting some of those tips and tricks and strategies and technologies is going to transform the uh, the foundation and nonprofit space. I believe people are very frightened of technology. I hope I've done a bit to dispel that fear, but I want to conclude by saying I want to conclude by saying that it's essentially the way that we'll be able to really leave lasting impact in the world uh, at scale.
Yeah, there are a couple of other comments around the importance of social listening, and digital search is an expression of intention to act towards perhaps a desired behavior. Now, that closing the loop to look at whether the search really leads to desired behavior is the multi-million-dollar question. Uh, so, I'm not going to be able to do more in terms of the audience engagement. I do have a few closing remarks, if I may be permitted a few minutes to make them. I do see people will drop out very soon, but I do want to emphasize some things. Firstly, I want to say this is really an exciting panel. The number of people that showed up is low, so I hope we can actually live stream it again sometime. I know many colleagues at the foundation are very interested in hearing this again. Why? Because there we still do lack evidence around edutainment. We are convinced around the power of edutainment. We are convinced that the transmedia is the way to go, because we know that media platforms are both a site of engagement for multiple subgroups of population, and also a site for changing discourse. I mean, that's very clear. Even from the time that I've been following Makbaksh, I know that that is clear to me. But the point is, we were really lacking evidence, and I think what we have here is a powerful transmedia intervention with really interesting evidence, and some that we haven't even discussed today, which is really the IVRS and the chatbot, which PFI will continue to harness and provide us insights from. So I think this is a big contribution to the field. And I want to echo what Tom said, that changing these sticky norms and behaviors in family planning is not easy. So whatever has been achieved in the short duration that the evaluations could track is still quite compelling. And so I want to kind of commend the visionaries and the creators and all the people who engaged in that process, because I know it's been a long and arduous process. I would also like to say a few things from my perspective as somebody who wears like a Emily hat. One is that while we recognize the behaviors are difficult to change, this we often are talking about social norm change, but social norms kind of change over time for a multiple set of reasons, and no singular intervention can really change norms. So sometimes I think our language needs to be a little more nuanced. Maybe what we are doing is interventions as riding the crest of norm change. Sometimes interventions are happening in an ecosystem that is changing already. For example, COVID is an exogenous shock which has started to change a lot of norms even around digital use and behavior. This couldn't have been anticipated 6 months ago. So I think riding the crest of that norm change, interventions are need to be fungible and designed so and adaptable to do that. And what's really important is the evaluation, the research also needs to be similarly real time, adaptive. And I think we cannot have very fossilized, stodgy designs of evaluations. We have to keep innovating on evaluations. It's just the way the interventions are innovating. And these need to be married and they have to go hand in hand together. You cannot design an intervention and then bring in an evaluation. These need to be co impacting each other. And that's really a big learning, even from Makbash. The interesting other thing which I want to say is that the audience is very sophisticated. The ecosystem and the mediums, multiple mediums are very fragmented, but I think the user is sophisticated and they are seeking experiences for their diverse, covert, overt needs, and they're navigating these mediums. They're moving from broadcast schedules to live streaming where they want more choice, more autonomy, maybe more privacy. Sometimes users need interaction, more interaction for certain kind of issues. Sometimes they need more time. Sometimes they have very little time and they are on an Insta. When they have more time, they can consume a TV show. All of that is important, and we have to look at this multiple needs of multiple users who have the ability to make choices. And I think what interventions and evaluations need to do is to keep factor that in, accommodate that in as designs need to innovate too. Um, I think the first Makbash seminar, I really loved the idea that narrative storytelling and serialization and sequential storytelling is really important for behavior change. People want to get hooked to drama. They want to see change in other people's lives. They want to live those realities. And so I think that we also see that that is true. That is getting validated in perhaps some of the positive results we are seeing. I would say that the evaluation and research community needs to be more pluralistic, more innovative to accompany this journey of the user and journey of the transmedia interventions. And learning more from digital and is really important for us. So I like the combination of the OPM evaluation and the Quilt evaluation here because it gives you the understanding of the potential and the power of these complementary insights that these two evaluations are bringing for us. I do want to say that there are some questions that I still have, which is that what is the ideal optimum combination of medium? Given the plethora of choices, what is the optimal mix? Do interveners have the right evidence at the outset to make these choice? And also how much exposure and how frequent in what medium, and what is the precision around that, and what is the science that underlies this? I don't think we'll know all of these remain questions until we continue to bring more and more evidence to bear on these questions. So I think what we've done is that we are really starting to bring this design thinking and creativity with the evidence, and that to me is very powerful. um, I think the changes in media landscape that we see today are offering us both challenges and opportunities to enhance edutainment. And we have to constantly look at the fact that we are trying to target audiences in this increased polarized fragmented landscape, and we just need to get smarter and understand how to get this better and with higher precision. And the research and evaluation needs to continue to play this dance with the entertainment education. It's not a dance alone that the intervention should be playing. So and what I see here in this intervention or in this package is the fact that, you know, traditionally you would use formative research for design and then summative research for evaluation. What I see here is that we are actually doing both. You've used what lies on the medium on digital as both formative and summative, and to me that's very powerful. So congratulations to all the entrepreneurs and researchers and designers and thinkers on this panel. I think you brought some really important learnings globally for everybody. So I really want to congratulate you. Over to you, Sita.
Thank you so much. Thank you, Priya, and thank you to our panelists, and especially thank you to our audiences for joining in and sharing their questions with us. We will share the recordings with all participants and panelists so that we can disseminate this webinar across our networks as well. Thank you.
But there is, I think, Dr. Qureshi, who had a desire to ask a question. Is there time? I don't know how to unmute him.
Sorry,
And people may be dropping out, but I do want to give him an opportunity if he's still here.
I can.
Would you like to go? I mean, literally yours might be the closing thought.
Can you hear me?
Yes, yes. Please go ahead.
I'm very sorry to come in late. It's a feedback which both the evaluator probably missed. It's about the name of the serial. Instead of arousing curiosity, it was a straight giveaway. मैं सब कुछ कर सकती हूँ, सब कुछ भी कर सकती हूँ, which means here is a maverick of a woman engaged in a bravado. So it is, to my mind, it is a title which is off-putting rather than attractive. So do you think, Poonam, if you were to do it again, would you like to create some curiosity about the title? Because instead of entertainment, it was straight away education, and you were giving it away in the first place.
So should I answer, or did you have questions of others?
No, this was the only one, Poonam, and you get to end this.
Okay, great. So I'd like to say two things. First, that the fact that equal number of men saw the serial, to me, proves that it didn't put them off. I thought men will not watch the serial because of the name. And we never expected a 50% viewership. That's one. Two, even if nothing else happens and women say, especially, you know, in the media dark areas, the remote areas, through Doordarshan, our choice of Doordarshan actually states that we are trying to reach the most disempowered woman, the most poor, low literacy. Poverty goes with low literacy and everything else. And if the woman just says, I always think of even if a woman repeats 5 times, मैं कुछ भी कर सकती हूँ, देखने जा रही हूँ या देखूंगी. To me, Dr. Qureshi, it is a concept whose time has come, and I do believe that, from our qualitative research, there wasn't much qualitative research here, but we did a lot of qualitative research in season 1 and 2, and we are on that mode all the time when we meet communities or we get feedback from NGOs and others who use it. And, the name has not ever come up as something putting off. In fact, we've got more interest in the positivity of the concept than before. But you have a PhD from Jamia in communication. So for me to be saying all this to you, I say that with a lot of audacity. But I will not change the name unless you can convince me to.
Okay, so that would be a coffee with Dr. Qureshi some other time.
Thank you very much.
Thank you, everybody, and over to the center to just literally close it because I know it's late.
Thank you so much. Thank you for all our audience members to stay with us this long, and thank you to our esteemed panel for just making this such a great discussion. Thank you, everyone. Have a good night.
Bye-bye.
Thank you.
Thank you. Thanks, everyone.
Thanks, everyone. Bye-bye.
Bye.
Thank you.